Hello, my name is Sarah Cruz. This presentation is the Global Health Landscape. Today is April 13th, 2025. Researchers have found that the burden of disease reported each year can be attributed to past exposure to a risk. Burden disease is seen in all ages, children, young people, and older adults. Global Health Landscape is to improve people's lifestyle throughout the world. Modifying policy reasonable changes to lower effects to climate, agriculture, and economic systems. Global burden of disease is the collective health gap caused by all diseases and disability in the world. The study estimates health gaps for a comprehensive set of disease and injury causes and major risk factors. Yearly updates and refinement throughout the GBD study can create opportunity to compare to other countries and to understand the leading cause of health loss in some areas. Frequent studies like climate change, agriculture, and economic status is beneficial to burden disease because of the correlation. Each of these categories influence the people in the world. Climate change, agriculture, and economic status are effective in causing issues in health and living conditions. There has been concern between ambient air pollution and human health, and data have shown that approximately 4.2 million deaths and 103 million disabilities adjusted life years were attributable to exposure to particles, which was collected by the Global Burden of Disease study in 2015. Furthermore, 16% of all premature deaths in 2015 were attributable to pollution. Research has found that there is a relationship between air pollution and children's asthma. Frequent visit in the emergency room, school absences, and storage dependency. Researchers found that traffic-related pollution and children's asthma are related in several areas of the world. For instance, countries with poor health care access. The effects of agriculture can be due to genetically modified organisms, GMOs, which is also known as genetically engineered seeds. Genetically engineered crops could be used when there is a chance of climate change and new crop pests and disease can emerge in new regions. GMOs are considered to be used due to drought tolerance and herbicide resistance. GMOs is revolving, and it is important that food and health professionals develop an understanding of the details of farming with GE technology. According to the World Health Organization and other government agencies, rules that these products are safe. However, several other groups would like to have continued research for GE. The concern is that GMO crops are causing water contaminants and potential carcinogens. Additionally, these contaminants are affecting the environment, food, drinking water, and farm labors. Farmers are at high risk because of the direct contact. For instance, the Florida tomato industry have been exposed to heavy use of pesticide with poor policies and protection. The future population can develop health habits that can extend their quality of life. The effects of economic systems can shift global economic development unless effective strategies are to be out into place. For example, burden of disease can continue to increase in the younger population, which includes mortality, disability, injuries, and health risk factors. Furthermore, to ensure people behaviors are changing, the economic system would allow to have access to health care. Sustainable adoption of new technology that leads to improved health outcomes depends on strategic and systemic design, development, and integration. To continue research in developing economic system, financial funding is adequate. Additionally, people are modifying their health habits because of easily access to health care. The spread of technology connection can come with opportunity for better health outcomes. For instance, access to information, avenues for communication, reduced distance between patient and providers, and access to resource. In summary, to improve burden disease is to ensure the world's decision makers, development partners, and the people need to make good decisions about how to use money, human resources, and how to effectively address health issues. Furthermore, climate, agriculture, and economic systems depend on each other because it can affect the person's life. Comparing burden disease throughout the world can help by understanding the impact of risk factors, gaps in regional and global comparative contexts. And that concludes the presentation. Here is the list of references that were used in the presentation. Thank you. Bye-bye.